Hi everyone, welcome back. Dr. Nina here, and today I wanted to talk to you about the different subtypes of Alzheimer's type dementia that Dr. Bredesen has outlined through his ReCODE protocol. When we assess an individual for memory loss concerns, we are looking at these subtypes to try and to determine more specifically what could be contributing to the cognitive dysfunction a person might be experiencing. So when we look at what the possible contributory factors are, there's 6 different general areas that we are assessing to see if they fall under a smaller umbrella so we can then make treatment much more specific when we're working with a person. The first type we look at, type number 1, is called the hot or inflammatory type. This has to do a lot with individuals who carry the ApoE4 gene. Often people with this type of Alzheimer's present earlier, say in their 60s, and they have a lot of amnesic presentation. So they're often forgetful, losing track of words, unable to name nouns, family members, things like that. The contributory factors for this type of Alzheimer's have to do a lot with genetics, but also environmental factors. So we are working up things like a stress assessment. How much is stress playing a role in this? We're looking at toxins. Could there be environmental pollutants, heavy metals, mycotoxins from mold exposure? We're looking at food antigens, in particular inflammation coming from the digestive tract. We know that there's a deep connection between the brain and the gut. And so these individuals may have a lot of IBS type symptoms, may have a lot of reflux or GERD, may have some chronic congestion in their sinuses. We would be assessing the gut here in much great detail to try and determine if there's some culprits that could be causing an inflammatory cascade, triggering these changes in the brain. We look at poor sleep. We know sleep is such a huge contributory factor when it comes to, a myriad of disease, but certainly Alzheimer's. And I will spend some time in another video talking about aquaporins and how they clean up and detoxify our brains at night. And so if we're not sleeping, the brain does not get an opportunity to clear any damage or neuroinflammation that happened during the day. This type of Alzheimer's, we also look at social isolation. We know that loneliness is a huge contributory factor to memory loss and cognitive concerns. So when we're looking at this type, this is what we're assessing. Some interventions we might be recommending if we determine an individual has this type 1 subtype of Alzheimer's might be things like stress reduction skills, so mindfulness, meditation, heart rate variability. There's lots of wonderful tools and wearables on the market these days to assess heart rate variability. We're going to assess the gut. As I mentioned, we are going to remove any food sensitivities, clean up any dysbiosis that could be occurring in the microbiome. We're going to really work on sleep and make sure an individual is sleeping at least 7.5 hours a night at the very least and getting restful sleep at that. And we're going to work on supporting an individual getting socialized, getting connections back in that sphere with friends and family and different in groups in that respect. The next subtype I want to talk about is type number 2. We consider this cold or atrophic. And this often presents a bit later. So this is for individuals who show Alzheimer's or memory loss concerns starting in the 70s, maybe even early 80s. So it has to do a lot with some neurotrophins I'll talk about in a minute, but we look at, when we say cold, a loss of trophic factors. And what trophic factors are all of our hormones and minerals and vitamins that play a role into creating a perfect environment for the brain to remain healthy. So when we do this assessment, we are going to look at vitamin D levels. We're going to look at your micronutrient and vitamin and mineral levels. We're going to look at your sex hormone levels, your thyroid hormone levels. We're going to do a great assessment just to make sure that the internal support system is where we want it to be. This cold or atrophic subtype, we want to essentially assess for things that drive BDNF and NGF. That stands for brain-derived neurotrophic factor and nerve growth factor. Now, these are neurotropin family of growth factors, so they're in our brain, and they play a big role in the growth and survival of neurons. They serve to be neurotransmitter modulators. They participate in neuroplasticity, so help us with learning and memory. And we know that lower levels of these two neurotrophic factors are associated certainly with Alzheimer's, but also other diseases such as MS, Parkinson's, and Huntington's. When we look at normal age-related hippocampal volume, we know that in a healthy brain, we'll lose about 1 to 2% of volume a year as we age. This is not associated with any cognitive or memory loss. But when we start to see BDNF levels going down, we think this is a contributory factor to deteriorating hippocampal volume even more. And individuals with Alzheimer's disease tend to have a 3 to 5% loss of their hippocampal volume per year. So what can we do about this? If we find this to be the subtype that we're dealing with, then we want to look at supporting increasing BDNF and NGF. And there are several ways that research has pointed us to be able to do this. A few things that we have found are DHA, so a component of the omega-3 fish oils. They're the anti-inflammatory type of PUFA. Now, PUFA are a double-edged sword. I've mentioned them before. But PUFAs, we want to have a lot of omega-3s, but not a lot of omega-6s. So too much oxidized or rancid omega-6s, which comes in things like corn oil, for example, very bad. But very clean omega oils, particularly high DHA, seems to have some evidence that this could increase BDNF, which is great. It's also been found that exercise enhances these neurotrophic factors. So getting moving, especially getting that heart rate, cardio, and energetic exercise up, we will see these levels increase in studies. We also look at stress. We want to make sure prolonged stress is not occurring because that will reduce BDNF. So we work on some of those stress reduction techniques. And finally, intermittent fasting. There's been some newer research showing that doing intermittent fasting can in fact increase BDNF and therefore enhance the healing and support systems in the brain. The next type I wanted to mention is type 1.5. That's our sweet. So this is kind of a combination of 1 and 2, which is why we name it 1.5. There's inflammatory pieces to it, but also atrophic features. One of the biggest contributory factors to this type is insulin resistance, leading to secondarily inflammation in the body. So the biggest area we look at here is individuals that are metabolic syndrome or diabetes, and our main intervention here is managing and supporting improvement in blood glucose levels and insulin levels. So we use a ketogenic type diet depending on someone's ApoE status, Mediterranean, keto flex, really getting carbohydrates, grains, sugars out of the picture, because the more we can reduce blood glucose, the less inflammatory cascade triggers will irritate the brain. The third type I want to mention is the toxic subtype. This is a trickier subtype and tends to lead to more complex and challenging cases. This subtype has to do with exposure to irritants that are noxious to the brain. The brain then makes amyloid in response to these irritants. So the point being, we test for these and try and remove them as best as we can. So these would be things like heavy metals, environmental pollutants, including things from personal care products and food sources, looking at dental implants, the amalgam fillings from your dental fillings, looking at herbicides, pesticides, mycotoxins from mold exposure, tick-borne disease, which has been a major challenge lately and just seems to be more and more frequent in our human population. So these individuals often are negative ApoE. They tend to present younger. They tend to have more psychological and mental health challenges, things like depression. They're very sensitive to stress. So they do worse when they're under chronic stress or traveling, or they get poor sleep. They really tend to deteriorate. And when on imaging, we'll not see the hippocampus or general volume of the brain affected as much. So these individuals, our goal is to test for all these complex chronic infectious and environmental pollutant exposures, remove them from the environment, and treat them if necessary. The fourth subtype I want to mention is vascular. So this has to do more with individuals who have cardiovascular concerns. So maybe we have both inflammation, high cholesterol, a family history of cardiovascular disease, some blockages in the vessels of the heart. Maybe there's some poor circulation in the legs. These would all be things that we would be looking for. We might also see on an MRI some microvascular disease in the brain. So anybody here with metabolic syndrome and cardiovascular disease, this is where we're really looking to support the cardiovascular system. And we're doing this with some omegas. If they're safe to do, we're doing this with improving exercise tolerance. We are improving vasculation and circulatory system supports through herbs and nutritional supplements, and also looking at diet as well to remove the excess triggers that could be contributing to higher levels of inflammation in the vascular system. The last subtype that we discuss is head trauma leading to chronic encephalopathies. We, of course, heard about this through a lot of the athletes with recurrent concussions, knowing that repeated head trauma can cause brain deterioration over time and lead to dementia and mental health deterioration as those individuals age. So when we look at that, it's a lot based on history. We can do some MRIs, and often in these individuals, we're recommending things like HBOT, hyperbaric oxygen therapy, a lot of the brain supportive herbs and omega oils as well, to try and support any damage that could have occurred from previous activity or injuries. Okay, so I hope you got some insight into what we are looking for when we assess any individual for memory loss or suspected concerns in the future from a preventative perspective. And I look forward to seeing you again at our next video. Thanks, take care.